Okay, so hi folks. I'm just going to do a quick video on the diploma in emergency medicine. I would strongly advise that you listen to this and go over it before your interview, as the panel will expect you to know something about the program. Okay, so during this talk, we're going to just very briefly define emergency medicine, compare the diploma and DM, and discuss the diploma in some more detail. Its structure, its requirements, how we teach, and how we teach. See if you can come up with some reasonable definition of emergency medicine. You may be asked this in your interview. Here's my definition. It is the practice of medicine involving the diagnosis and treatment of any patient requiring unscheduled episodic care with an acute injury or illness. And our mandate is to limit morbidity and mortality in these patients. And if we think about it like this, then emergency medicine can span from pre-hospital care into the inpatient disciplines closely related to emergency medicine, such as acute medicine, trauma, and intensive care or critical care. This definition is used by the Trinidad and Tobago Emergency Medicine Association to define the specialty and those within it. So we have two emergency medicine programs in Trinidad. The first is the DM. This is a full-time residency of 4 years, and it includes essential rotations to other specialties, at the end of which you get a degree which is recognized as a specialist degree by the medical board. Because it's a full-time residency, you have to be fully registered with the Medical Board of Trinidad and Tobago to be accepted into this program. The diploma, on the other hand, is an 18-month part-time program, which is really aimed at emergency medicine and primary care physicians who deal with emergency and urgent care. Because it's part-time, because our residency is not part of the program, we expect you to come in with some amount of experience, at least 6 months experience post-internship. This degree is not recognized as a full specialist degree by the medical board. This is just a picture of our very early class. Some of you will recognize Dr. Richard here. It's our first class. You may also recognize Dr. Etienne, and I'm not seeing others. You may recognize some of the others, like Dr. Neesmith, Dr. Sinanan. So this is an outline of the diploma. As I said before, it's a part-time course over 3 semesters, and it really targets primary care physicians, emergency medicine doctors working in peripheral hospitals and emergency departments, and it has been taken by some specialists in other fields, or doctors who have gone on to specialize in other fields. Because of all this, we expect you to have some ED experience, and we expect you to be working in the ED while doing this course. So in terms of admission, at least 6 months prior experience, and then currently working in emergency department, supervised. Sometimes people are rotated during the program. If you're not in emergency medicine for maybe a semester or less during the program, we might allow this, but that has to be approved by the program coordinator. We accept people from both the adult and pediatric emergency departments. It is a recognized additional qualification by the Medical Board of Trinidad and Tobago, but not a specialist qualification. The backbone of the course is our weekly tutorials, which are already made up of didactic lectures and interactive sessions. You're also required to write up some cases in a logbook, and you will have some face-to-face sessions with simulated patients, things like life support training and skills training on simulated patients. For some of the modules, there are mandatory clinical sessions that you must attend. We expect you to have completed your life support courses before the end of the program, that is advanced pediatric, trauma and cardiac life support. We do offer other courses such as the airway course and the basic ultrasound course. And there are regional grand rounds which you will be expected to attend virtually. The assessment is both formative and summative. So during the course you will be assessed on your logbook, your clinical practice, skills training, case reports and assignments in some cases. The final exam consists of a written exam, which is MCQs and data, and an OSCE and oral exam. And these are the courses, topics that you'll be covering during your 3 semesters. I would advise you to pause the video here and have a proper look at these and talk to people within the program to better understand what the content of each module entails. Just to emphasize some of the other things that we offer during the diploma, including life support courses, other courses, some clinical experience which you need to get signed off, and some additional skills training. Make note that your marks consist of both formative and summative assessments, so 40% of your mark is coursework, and these deadlines must be met. The university does not tolerate plagiarism. If you are found to be deliberately plagiarizing, you may be asked to withdraw from the program. So the degree is recognized as an additional degree. It is not a full specialist qualification. Just to re-emphasize that. So just quickly to talk a little bit about the benefits to patients. Of course, when you're trained, you'll be better at trauma management, cardiovascular care. We believe that trained doctors work more efficiently and therefore waiting times are reduced, and we reduce the possibility of misdiagnoses as well. A well-trained doctor uses resources more efficiently, has an eye on the department as a whole, so therefore properly trained doctors are less likely to allow a department to get unnecessarily congested, and can also think a little bit more broadly about systems development. This is just a list of some of the things that the emergency medicine training as a whole, not just the diploma, has brought to Trinidad and Tobago, and I'm sure this list can be added to. I'm sure you can think of other benefits that the program may have brought. Again, you may be asked something like this in the interview: how do you think this program has benefited your region or the country? So that was just a very quick talk about the Diploma in Emergency Medicine. If you have any questions, you can give me a call. I'll also be sending you an email regarding a little bit more about what the interview will look like. So thank you very much, and we will thank you very much, and we'll stop the video here. Thank you. Bye.